Hey guys, welcome to day 21 of our March Madness practice questions. As always, I like to do my introduction and disclaimer before we get into our questions for today. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and founder and CEO of the Nursing Studio. I provide resources and courses and videos to assist nurses and nurse practitioners with being successful on boards as well as in practice. I've been doing this since 2015, helping thousands of nurses and nurse practitioners internationally with a 99% pass rate on all of our courses and 100% pass rate on our one-to-one session and review students. But, I always like to give the disclaimer before I get into any of my content or material to remind you guys that we know that there's no absolutes in medicines. We treat on a patient by patient basis. And anything that I design, if there are questions, they're going to be based off of the current guidelines that are on the current test. And if it's anything that I'm teaching on practice and what to do in practice currently, then it'll be based off of the guidelines. And I'll say that to clarify so there's no confusion. But let's get into question number one for today. All right, as question number one comes up, question number one states the nurse practitioner is completing a fundoscopic exam and notes cotton wool spots. Based on these findings, what should the nurse practitioner evaluate? Is it A, hypertension, B, lipid panel, C, hypertension and diabetes, or D, CKD? Take a moment and tell me what you got in the comments. All right, I always recommend reading the stem of the question first. The stem of the question here states, based on these findings, what should the nurse practitioner evaluate? So, what are we evaluating? We're going to take it back, like I always tell you, we need to study assessment, diagnosis, evaluation, and treatment. If we are evaluating something, what is the diagnosis or potential diagnosis, and how have they presented? What's the assessment findings? So here, the assessment, the fundoscopic exam, cotton wool spots was noted. So what are we evaluating when we note cotton wool spots? Is it A, hypertension? Yeah, we'll keep that in here. Um, is it B, a lipid panel? No, that doesn't have anything to do with cotton wool spots. Lipid panel, you need to start thinking Arcus is based off of the patient's age, right? C, hypertension and diabetes. Yes, that's your answer. You want to look at both these areas, but most commonly, diabetes is the area that you want to focus in on with cotton wool spots because that's the most common cause, but hypertension can contribute. But again, diabetes is the most common source of cotton wool spots. Remembering that cotton wool spots is when there has been damage to the nerve fibers from uncontrolled diabetes and or hypertension. So C is your answer. Hypertension and diabetes. Again, diabetes being most common. All right, question number two. A patient presents to the office today for follow up. The patient has a history of hypertension, diabetes, and gout. Lab results reviewed, and the lipid panel is as follows: total cholesterol is 258, triglycerides are 652, LDL is 99, and HDL is 42. Based on these findings, how should the nurse practitioner treat? Is it A, prescribe a statin, B, prescribe niacin, C, prescribe omega 3 fatty acids, or D, prescribe fenofibrate? Take a moment and tell me what you got in the comments. All right, the stem of the question states, based on these findings, how should the nurse practitioner treat? So for treating, we need to see what diagnosis we have going on, the assessment, all the things, right? So patients just coming in with follow-up. We see they have a medical history of hypertension, diabetes, gout. We're looking at this lipid panel. Total cholesterol is elevated, right? So total cholesterol is elevated because it's 258. It should be less than 200. Our triglycerides are extremely elevated at 652. They should be less than 150. And we'll come back to that. Our LDL is 99. It's right there. And honestly, from a cardiac standpoint, they should be less than 70 because they have multiple comorbidities. They have more than two comorbidities. And then the HDL, we want greater than 40. And if this was a male patient, we would want it higher than that. So they can work on that HDL. But here, the lipid panel, is clearly abnormal, but you want to focus in on those triglycerides. Whenever triglycerides are greater than 500, in your mind, you need to consider and rule out pancreatitis, but your first line therapy is now niacin. So the answer is B, prescribe niacin. If your triglycerides are greater than 500, first line therapy is niacin. I know that the standard first line therapy for the treatment of an elevated cholesterol, elevated lipid panel, hyperlipidemia is prescribing a statin, right? But when the triglycerides are 500 or greater, you go straight to a niacin. So again, the answer is B. I have some videos on that too if you need more clarification. All right. Now, question number 3. A 42-year-old female patient presents to the office for follow-up. She complains of continued weight gain and irregular menstrual cycles. The nurse practitioner documents her truism as well. Based on these findings, what diagnostic exam should be completed? Is it A, an X-ray, B, abdominal ultrasound, C, transvaginal ultrasound, or D, nothing at this time? Continue to monitor. Take a moment and tell me what you got. All right, so similar question states, based on these findings, what diagnostic exam should be evaluated? So, all right, we're trying to confirm a differential diagnosis, right? So we have to step back and look at our assessment, the way they presented their signs and symptoms, what's their presentation, what is the subjective, and then what is the objective, and then what do you do when you're considering that? So the patient is already complaining that they have continued weight gain, they're having irregular menstrual cycles. That's your subjective of your assessment, right? That's their presentation. And then the nurse practitioner has documented also the hirsutism, meaning facial hair, for the female as well. And so in your mind, you should start to process differential diagnoses like PCOS, right? Polycystic ovarian syndrome. And so next we do diagnostic evaluations. And when these questions are asked, you always go with the gold standard exams for that answer choice. But if you're considering PCOS, what is the best gold standard diagnostic exam to confirm that diagnosis? And the answer is C, a transvaginal ultrasound. X-ray is not going to do anything. We don't need to look at an abdominal ultrasound. It's the transvaginal ultrasound, because what is polycystic ovarian syndrome? Due to a hormonal imbalance, there's really it's really idiopathic on the definitive source and cause of this, but due to the hormonal irregularity, it causes these enlarged ovaries and cysts on these. So you need a transvaginal ultrasound to confirm this diagnosis. So the answer again is C, and you should have thought PCOS for this one. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But be sure to meet me back here. You know, we've been doing this all month long. If you are just jumping on board, go take it back. You'll see a full series daily of these questions, just to test your knowledge, engage, and it's in all various systems to get you prepared for boards with the new updated blueprint and exam. But if you need any additional resources like our review book, or if you need to do any of our courses, we offer an online self-paced course that you do at your own pace. We have our next cohort of the 5 week intensive is up and coming. It is April 8th through May 17th. So you can go ahead and enroll in that class before we fill up. And then we have our one-on-one courses as well, where we focus in on various things. So if you want to focus on your weaknesses and making those your strengths, we can do that. If you want a custom package to help you to come from unsuccessful to successful on boards. We do custom packages as well to meet your budget. But just call us at the Nursing Studio at 803-400-6864, or shoot us an email at the Nursing Studio, the number one at gmail.com, so that we are able to do a free consultation to kind of see what you need and help you with those. But we look forward to working with you. Happy studying. Take the time you need. Do the questions when you are on the go to kind of quiz your mind, and do all the study tips and tactics to kind of gauge and make studying fun and throughout the day, because you got to do it. And even though it's overwhelming, it's a lot, but this is only temporary to get to your goals, and then it's behind you. So stick with it. I wish y'all all well, and I will talk to y'all later. Bye, y'all.